Have you been feeling unusually tired lately? Maybe you've noticed a decrease in your libido, or perhaps you've been struggling with mood swings. We're diving into the world of low testosterone, a condition that affects a surprisingly large number of people, yet often goes undiagnosed. It's a topic that's not discussed nearly enough, and many individuals may be experiencing symptoms without realizing the root cause. Low testosterone, also known as hypogonadism, can manifest in various ways, from physical changes like hair loss and weight gain, to emotional shifts such as mood swings and depression. It's a complex condition that can have a profound impact on one's quality of life. But the good news is, once identified, it can be effectively managed. If any of this sounds familiar, you might be dealing with low testosterone, but don't fret. You're about to learn the 20 common signs of this condition. Let's dive right into the first 5 signs of low testosterone. First off, we have decreased libido, which is a reduced interest in sexual activity. This doesn't mean an occasional lack of interest, which everyone experiences from time to time. We're talking about a persistent and noticeable decline in your desire for sexual encounters, a change that's out of the ordinary for you. Next up is erectile dysfunction. This refers to the difficulty in achieving or maintaining erections. It's important to understand that occasional issues aren't uncommon, but if you're consistently struggling with erections, it could be a sign of low testosterone levels. Then there's fatigue, which isn't just feeling a little tired after a long day. It's a persistent lack of energy and motivation that doesn't seem to go away even with adequate sleep and rest. If you're constantly drained and struggling to stay motivated, it could be a signal that your testosterone levels are dipping. Fourth on our list is the loss of muscle mass. You might notice a reduction in muscle size and strength, even if your workout routine hasn't changed. This isn't about not hitting a new personal best at the gym, but rather a noticeable decrease in your overall muscle mass and strength. Finally, we have increased body fat, particularly around the abdomen. If you're eating healthily and staying active, but still noticing an increase in body fat, especially around your midsection, it could be a symptom of low testosterone. That's just the beginning. Let's continue to the next set of signs. Picking up where we left off, here are signs 6 to 10 of low testosterone. Becoming a moodier version of yourself could be sign number 6. If you're experiencing irritability, depression, or difficulty concentrating, it might be due to low testosterone. This hormone plays a crucial role in our mental well-being, so fluctuations can significantly impact our mood and cognitive abilities. Sign number 7 is decreased bone density. Testosterone is important for bone health, so a decrease can lead to osteoporosis, or an increased risk of fractures. If you've noticed you're more prone to fractures, or your doctor tells you that your bone density is lower than it should be, low testosterone could be the culprit. Next up, at number 8, we have hair loss. Now, it's important to remember that balding can be a natural part of aging for many men. However, if you're losing hair on your body and face, not just your head, it might be due to low testosterone. Testosterone plays a role in hair production, so a decrease can lead to thinning or loss of hair. Sign number 9 is hot flashes, a sudden feeling of warmth often accompanied by sweating. While more commonly associated with menopause in women, men with low testosterone can also experience this symptom. This is due to hormonal imbalances that affect the body's thermostat, causing these sudden spikes in body temperature. Rounding out our list at number 10 is difficulty sleeping. If you're struggling with insomnia or disrupted sleep patterns, it could be a sign of low testosterone. Testosterone levels naturally rise during sleep, and low levels can disrupt this cycle, leading to poor sleep quality. Now that we're halfway through, let's move on to the next batch of signs. Moving forward, let's look at signs 11 to 15 of low testosterone. 11th on the list is reduced semen volume. Testosterone plays a vital role in semen production, the milky fluid that aids in the motility of sperm, so it's no surprise that low testosterone levels might lead to a decrease in semen volume during ejaculation. Next, we have shrinking testicles. Testosterone is crucial for maintaining testicular size. When levels of this hormone drop, you might notice a reduction in the size of your testes. This condition, known as testicular atrophy, is often accompanied by a feeling of softness in the testicles. The 13th sign is gynecomastia, or the enlargement of breast tissue in males. This happens because low testosterone can upset the balance between estrogen and testosterone in the body, leading to an increase in breast tissue. It's important to note that while this may be uncomfortable or distressing, it's usually not a serious health risk. 14th on our list is infertility. Testosterone is essential for sperm production. Therefore, lower levels of testosterone can lead to decreased sperm production or impaired sperm quality, potentially causing fertility issues. Finally, we have decreased motivation. Testosterone influences mood and mental capacity. When levels are low, you might experience a noticeable drop in your drive or ambition in various aspects of life, from work to hobbies and beyond. Each of these signs can manifest differently in different individuals, and experiencing one doesn't necessarily mean you have low testosterone. If you notice any of these signs, it's crucial to consult with a healthcare professional for an accurate diagnosis and appropriate treatment. With only 5 signs left, let's delve into the final batch. Finally, we've reached the last 5 signs of low testosterone. Sign 16 is loss of bone mass. That's right, low testosterone can lead to a decrease in bone density. This increases the risk of fractures and osteoporosis. It's like the very framework of your body is being undermined. Then we have sign 17, memory problems. You might find it difficult to remember things or to concentrate. This isn't just about forgetting where you left your keys. It can seriously impact your daily life, making it hard to focus on tasks or maintain productivity. Sign 18 is reduced facial and body hair. This is another physical sign of low testosterone that many men notice. Thinning or loss of hair on the face and body can be quite distressing, as it's often tied to our perceptions of masculinity. Our 19th sign is anemia, or a lower than normal red blood cell count. This can lead to feelings of fatigue and weakness, and it's not just about feeling tired. Anemia can make it difficult to carry out everyday activities and can leave you feeling worn out and depleted. The final sign, number 20, is a decreased sense of well-being. This is an overall decline in mood and quality of life. You might feel less satisfied with your life or find that things you used to enjoy no longer bring you pleasure. It's a subtle sign, but it's one that can have a significant impact on your happiness and satisfaction. Now, it's important to remember that these signs can vary from person to person. You might experience some, all, or none of these symptoms. If you're experiencing one or more of these signs, it's crucial to consult with a healthcare professional for an accurate diagnosis and appropriate treatment. Now we've covered all 20 signs of low testosterone, but what's next? So you've noted some signs that may indicate low testosterone. What should you do next? First and foremost, don't panic. It's crucial to remember that these symptoms can be associated with various health issues, not just low testosterone. The best course of action is to consult with a healthcare professional. They can provide an accurate diagnosis and guide you towards the most effective treatment options. Healthcare professionals have the expertise and tools to conduct necessary examinations and tests to pinpoint the root cause of your symptoms. Whether it's low testosterone or another health concern, they can devise a tailored treatment plan that's most suitable for your condition. It's also important to remember that self-diagnosis can lead to unnecessary stress and worry. So rather than jumping to conclusions, seek professional advice. Remember, your health is your wealth. Don't hesitate to seek professional help if you're experiencing any of these signs. Until next time, stay healthy and informed.